This is a short video demonstration to review the benefits and importance of using biofilm DNA testing as a part of your diagnosis and assessment. Dentistry has evolved considerably in the past 10 years, and we recognize now more than ever the systemic impact that periodontal disease can have on an individual. Our patients are also more aware of this aspect, so it makes sense to utilize DNA testing in the same manner that physicians utilize blood analysis. DNA testing can help give you a more definitive diagnosis and aid you in creating a more individualized treatment plan. It acts as an independent risk factor to help evaluate periodontal disease risk and systemic risk. It will give you an overview of the pathogens that are present as well as their overall burden. It will help you to treat more preventively and proactively. It's also more important to note that absence of bleeding is not necessarily an indicator of health. So if you have someone who is showing progressive bone loss, even though they don't have bleeding, that's an excellent time to intervene with testing. We must assess beyond clinical signs, and DNA testing will also provide you a tool with which to collaborate with physicians. In November 2016, Dr. Bradley Bale, Dr. Amy Doneen, and Dr. David Vigorist published this article, which concluded that high-risk oral pathogens were causal for arterial disease. They emphasized that this type of periodontal disease is a medical condition with a dental solution. When something becomes or shows causality, it demands more from us. And if we are to position ourselves as an office that helps our patients to improve not only their oral, but overall health, then DNA must be a part of that. So some offices are using DNA testing as a component of their new patient exams. Perhaps your client is going to be having some heart surgery, and you could provide some testing and the treatment prior to their surgery. Someone may be presenting with a colorful medical history, such as diabetes, heart disease, dementia, or perhaps they have a family history of these conditions. Another example is when someone presents with several risk factors. The more risk factors someone presents with, the more likelihood of rapid periodontal breakdown and the more aggressive our treatment should be. Those individuals that are failing to heal, they still have bleeding in spite of our therapies. And you also may have someone who's relatively healthy or appears to be healthy and would just like to be screened to be very preventive. And then you'll have options based on their testing, whether to treat at that point or whether to monitor them. Clinical markers to help you with deciding when testing is important: papillary bleeding score of 2 or 3, bleeding on probing, 30 bleeding points or more. When visually you see edematous, inflamed, bleeding, spontaneous bleeding conditions. Someone who presents with moderate to severe gingivitis. Again, we want to be testing and treating before we see bone loss. Someone who has progressive breakdown, stage 3 or stage 4, perhaps even in the absence of bleeding, or if someone presents with periimplantitis or perimucositis. We're testing for all of those high-risk pathogens, P. gingivalis, T. denticola, 𝗙𝗓𝗓, and AA, as well as 2 moderate risk pathogens, Fusiform nucleatum, 𝗙𝗿𝗓𝗏 micros. We're also looking at Candida and Strep mutans. Candida is important to evaluate, even if someone doesn't look like clinically that they have Candida. A lot of times it's picked up in the DNA testing, and Candida will increase the virulence of the overall biofilm and will also increase the acid production by Strep mutans. So we're testing the saliva and the biofilm on the tongue and the gingiva. We're using tongue swab and 5 paper points. You'll register your samples online. We don't want you to send any paper forms in, and your results will be uploaded in the portal, and your treatment recommendations will be provided to you, and you'll get an email once those recommendations are complete. So just to review the testing, you're going to take with the tongue swab, go from tongue base to the tip of the tongue 2 to 3 times using fairly firm pressure. Turn that swab over and swab the lingual, gingiva, and teeth in all 4 lingual quadrants. You're going to remove that swab. Now you can actually break that swab right off. There's a little notch in the green stick that you can actually break that right off, which is a little easier than trying to pull off the sponge swab. And you're going to put that right into the collection tube. Then choose your 5 most affected sites. Try to choose at least one quadrant or one pocket per quadrant. And then your 5th one can be anywhere in the mouth. You're going to hold that paper point in that site for 10 to 15 seconds. Remember, it doesn't have to go right to the base of that pocket. It will still, just being placed into the sulcus, will draw out the DNA from the crevicular fluid. And then, of course, you're going to register your sample online. So to register it, you log into your portal at OraVitalSamples.com with your username and your password. Type in the vial on the number of the vial. And then you will have a page that will open up where you can put in all the patient information, any allergies, the clinical findings that you have, so that we can individualize the reports as much as possible. If you have not yet had your credit card put on file, please call home office to do that, which will expedite your processing rather than having to contact you for credit card information each time. You want to fill in the postage return address on the envelope. It's prepaid postage. The address should be P.O. Box 48032. So if you have envelopes that don't have that address, please call OraVital and we'll send you some new labels. And you're going to just place that vial into the plastic baggie and then into your postage paid envelope. So getting set up in the portal, if you have not yet explored the portal, there is a video. It's a 15-minute video that you can watch that will give you an overview of how to use that platform. The first time you log in, you'll be putting in a temporary username and a password. It will prompt you to change the password right away. And you can also change the username at that time, which we do recommend because it's much easier to remember something other than a long number. If you need to order more DNA kits, you can actually do that right in the portal. Just choose the number that you would like. You have the option for either free shipping or expedited shipping for a fee. This is how you will assign your kit to the patient. So you plug in your kit number and click on Assign to Patient, and then that window will open up where you can put all of your clinical information. Try to give us as much information as you can about the bleeding, papillary bleeding score, the pocket depth range, the stage and the grade of the periodontal disease, and any other factors so that we can really customize those reports. This is what your report will look like. Anything under the orange level are normal levels of bacteria. Orange is monitor, and of course, red is at or above threshold. So you'll be able to see at a glance what their overall pathogenic burden is as well, and whether they have candida and what their level of strep mutans is. Now, this is a real important chart to have handy. You might want to actually print this off and laminate it, because if you are doing a secondary report, perhaps 6 months later, you want to be able to show the patient that there has actually been a considerable change. And just 1 point change going from a, say, 7 in the logarithm chart to a 6 is a decrease from 10 million to 1 million. So it's a 90% reduction of pathogens with just 1 point. So it's important to be able to show your clients the differences and explain that so they see that there have been positive changes, and it can take months to shift a biofilm that has been unhealthy for many years. In the report, it's a great third-party document as well, because it explains each of the pathogens that are tested for and what their significance is with respect to periodontal disease as well as systemic health. And it's really ideal to print those DNA reports in color and give your patient a copy with them when you're giving them their medication. There'll be notes to you with an overview of what our recommendations are, as well as treatment recommendations for the patient, laid out very, very specifically in point form, so it's easy for them to follow. We don't recommend that you do a secondary testing prior to 6 months. And there are certain criteria also that we do recommend that has been followed. So they had to have been 100% compliant with their medications. Compliance is really key. If they're missing a rinse every day, or if they're not using the soft picks right after rinsing, that's going to impact the results. We also want to make sure that you're disclosing and making sure that the patient is managing their biofilm well every single day. They need to be using a maintenance rinse every day. There should be no pockets greater than 4 millimeters. There should be no bleeding, because if they have bleeding and you're retesting, you're going to be seeing those pathogens again. So why integrate OraVital DNA testing? Periodontal disease caused by high-risk pathogens is the most prevalent cause of inflammation, so it helps us to really assess that patient's risk level. Biofilm DNA is ideal to understand the types of pathogens present, what their overall burden is, their risk level, and it will guide you in your treatment planning. Patients with moderate to severe gingivitis, persistent bleeding, active periodontal or implant diseases, and/or halitosis are all candidates and are considered high risk. Antibiotic rinses, as you know, will be recommended based on the clinical findings and the pathogenic burden, their dental history, and the risk factors that they present with. So we all understand the risk of undiagnosed or untreated oral infection in the development of systemic inflammation and many associated diseases. So OraVital DNA testing will help to improve your communication with your clients with respect to systemic health, especially. It'll help them to understand why you're recommending the treatment that you're recommending. It's a great tool to enable you to be able to collaborate more with their physician or other healthcare providers. And it'll also help to increase your office production. We want to also just mention that we have many new marketing tools. Please log into the website to be able to access those and utilize these for your social media marketing so that you can let your clients know and perhaps attract new patients and let them know that you have a system that can help to treat their bleeding gums and their halitosis.